we've learned over decades that success in cardiac or heart attack rates were tied to what we call a chain of survival, meaning on the left half or early part of cardiac care, it had to do with paramedics and emergency medical systems or EMS teams. Similarly, this research, we found that stroke systems of care or chain of survival is tied to early paramedic and EMS interventions. Hello, my name is Dr. William David Freeman. I'm a neurologist, neurointensivist at Mayo Clinic and one of the co-directors of the Mayo Comprehensive Stroke Center in Florida. And I'm accompanied by my colleague, Dr. Robbie Talk.
I'm Robbie Talk, cerebrovascular neurosurgery at Mayo Clinic, Florida.
We're talking about this article that just came out about time is brain and for pre-hospital emergency medical service response time for suspected stroke and effects of pre-hospital interventions. And this article will be appearing in the June 2021 issue of Mayo Clinic Proceedings.
Yes, so the takeaway message for you, Dave, is what? I mean, what do you want people to remember from this paper?
Yeah, so the main take home of this EMS study was, number one, it was a large study of about 11,000 patients from the Florida registry. Second point was that there's a lot of potential room for improvement in early stroke care in the pre-hospital phase for paramedics to recognize stroke and get them to the nearest stroke center. Those are the two take-home points, Dr. Talk.
Absolutely. From my perspective, I think it's very important to continue to look at parameters and improving the efficiency of patients' care from the time they have a stroke to the time where we deliver treatment. And if we integrate EMS evaluation or assessment as part of our medical evaluation, it cuts down on the amount of time we need to put together to collect that information. So here, you're using the medical information provided by EMS as part of your assessment, and it will cut down on your time of assessment.
Exactly. Earlier recognition, can adjust things up and downstream. So if you know the patient's having a stroke, you can have the IR team, interventional radiology suite, ready, as well as the stroke teams ready when the patient arrives.
So Dave, you have done a lot of work with EMS services from previous studies that you designed, making an iPad part of the evaluation where you can see the patient while they're on the way to the hospital, where you can start your assessment much earlier than meeting the patient in person. What is Mayo doing differently to streamline, to cut down on the time that's required to collect the information before we meet our target point of treating the patient?
That's a great question, Robbie. I think one of our Mayo founders said the glory of medicine is it's always moving forward. I think we've always adapted that into our work. This pre-hospital stroke work was a large area that showed there's a lot of room for improvement by earlier recognition, earlier stroke scales. The work that we did in the pre-hospital phase used a robot or secure audiovisual, and this was prior to COVID-19, and it saved 8 to 10 minutes of time per patient. And so to do the mathematics on that, it's 1.9 million neurons lost per minute. So this is almost 15 million neurons saved if that team knows that there's an acute stroke patient inbound, and you can alert intravascular neurosurgeons like yourself, Robbie, and the entire team. We know that time is brain, but that math I just shared with you, and that earlier interventions lead to better outcomes in terms of modified Rankin scale. So that's the direction we've been going.
I look at it from, as a race, from time when the patient had the stroke until time where we deliver the treatment. It's just, you want to shortcut this time as much as possible. You want to remove redundancy. You want to remove anything that is not optimal. Imagine yourself, I mean, I look at it is that, you met the patient and you're able to meet the patient before they come to the hospital, through some sort of teleconnections using whatever technology, and there's many softwares that are now being used, but in the medical communication provided by EMS. So using that piece of information, it cuts down on the time you need for yourself as a physician when you meet the patient. So you're upfront with the information. By the time the patient comes to the hospital, you know what's going on with them, and then you move things to the next level. We have clinical scores for identifying large vessel occlusions, but from my perspective, delivering an individualized care for every patient is the most rewarding, because every patient is a little bit different, but you need a system that works for all patients.
Thank you. Yeah, and I think, many people have asked, this was really cool, but how does it relate to clinical practice? And what I would tell them is that stroke team right now, the past state was, it was a very passive process. There was a lot of downtime while the patient was being transported to your ER. That became an active process when we beam into a moving ambulance. Again, it's all about the needs of our patient come first. And I think that dovetails into what does this kind of work mean to patients. I think Mayo Clinic's core mission is, our patients are at the center of everything we do. This model that you mentioned, Dr. Talk, to streamline patient care is all about improving their experience and their outcomes.
So essentially, Dave, we are removing barriers, basically. Getting the information by beaming in and seeing the patient before you see them also eliminates the geographic and the time barriers and cuts them down significantly. Improved outcomes, and stroke is becoming one of those diseases that it's very reversible, and it's not a permanent condition as long as it's reversible. And in essence, it's one of the most rewarding disease in medicine that we can reverse and turn the outcome from a patient, from somebody who's going to spend the rest of their life at a nursing home versus somebody going back to a normal life.
Another question that comes up is, what is the next step in this line of research? And I think two things have changed dramatically in the last few decades. The first is that the world is going mobile. I mean, there are about 4.6 billion people out of 7 billion people on planet Earth that have a smartphone with some mobile chip in there. And then second thing is the amount of networks and 5G developing. Is this technology of telemedicine really is allowing the opportunity to almost see them anytime and anywhere on the globe, which break down those barriers, as you mentioned, Dr. Talk, about how to get to patients in rural and underserved areas. And then I'll finish with Dr. Talk. Where do you think this goes along with your skills as an endovascular neurosurgeon? Where do you plan to go next?
Talking about the 5G, I'm excited to see us, for example, doing robotic work. I'm hoping that if a patient with stroke 10 years from now, I don't see it this year or the coming few, but several years from now, even remotely, you can deliver the surgical and technical expertise and make it generalized to patients. So if a patient presents at a rural hospital, maybe with robotic capacities, that they can deliver a robot that we can guide from our locations to deliver the care to the patient and eliminate completely the geographic barrier.
That excites me. I'm sure you'll hear more from Dr. Talk and the team at Mayo on where this is going in the future. Again, I would welcome everyone to read this article that's coming out in the June 2021 issue of Mayo Clinic Proceedings. So thanks for listening in.
Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.